When assessing a patient with acute changes in mental status, clinicians often look for a particular physical sign known as asterixis. Though frequently associated with liver disease, understanding what asterixis truly represents, how it manifests, and its various etiologies can provide a more comprehensive diagnostic picture. This unique neurological finding offers crucial insights into a patient's underlying toxic metabolic state. Despite commonly being called a flapping tremor, Asterixis is not actually a tremor. Instead, it reflects a temporary lapse in postural muscle control. Think of it more accurately as negative myoclonus. This means there is a brief, sudden interruption in sustained muscle contraction, rather than an involuntary rhythmic movement. It signifies an abnormal function within the brain structures responsible for maintaining both alertness and posture. Because several parts of the brain must work together to hold a posture against gravity, asterixis is often considered a sign of widespread cortical disruption. Clinically, asterixis is observed when a patient is asked to hold their arms outstretched, with their wrists extended and fingers spread. What one then sees is an occasional and irregular motion. Typically, one hand at a time will experience a sudden flexion of the wrist. It then immediately snaps back to the previous extended position. This distinctive movement creates a bilateral, asynchronous, and non-rhythmic flapping motion, making it quite recognizable at the bedside. This fascinating sign isn't exclusive to hepatic encephalopathy, as many might assume. In fact, asterixis is a general indicator of toxic metabolic encephalopathy. This means it can appear in a number of other medical conditions that disrupt brain function. For instance, advanced renal failure, leading to uremia, can certainly cause it. Patients with severe chronic obstructive pulmonary disease, or COPD, may also display asterixis due to hypercapnia, which is often referred to as carbon dioxide narcosis. Other metabolic disturbances can also trigger this finding. Hypoglycemia is a classic example. Additionally, various electrolyte derangements can contribute, such as hyponatremia, which can cause cerebral edema. Hypocalcemia increases neuromuscular excitability, while severe hypercalcemia can lead to lethargy and cognitive slowing. Hypomagnesemia might promote tremor, myoclonus, and even seizures, and both hypo and hyperkalemia can impair muscle function, contributing to fatigue during sustained contraction. Certain medications, including sedatives like benzodiazepines, opioids, and some anticonvulsants, can also induce asterixis. In rarer cases, lesions in the thalamus or basal ganglia might cause it, though this usually results in a contralateral unilateral presentation. Given its broad range of causes, one might wonder why asterixis is so strongly associated with hepatic encephalopathy. There are two primary reasons for this historical link. First, it was effectively canonized as the liver flap after early clinical descriptions of patients with liver failure prominently highlighted this sign. This historical entrenchment solidified its place in medical lore. Second, and perhaps more importantly, asterixis often appears at a specific sweet spot in the progression of hepatic encephalopathy. Patients typically display it when they are encephalopathic enough for their posture to be affected, yet they remain sufficiently awake and cooperative to follow the instructions for the exam. Those with very mild hepatic encephalopathy or very severe forms might not show asterixis, as they are either too alert or too obtunded to participate. In essence, while the liver flap remains a historically valid and often real-world association, asterixis itself is a widespread sign of global toxic metabolic encephalopathy. Its visibility at the bedside hinges on a delicate balance. The brain must be impaired enough to lose postural control, but not so severely impaired that the patient cannot engage with the clinical examination. Recognizing asterixis should prompt a thorough investigation into all potential toxic metabolic causes, not just liver disease, to ensure a complete and accurate diagnosis.